future of health, interoperable, always-on data will promote closer collaboration among industry stakeholders. Not only will consumers have access to detailed information about their own health, they will own their health data and play a central role in making decisions about their health and well-being. Welcome to Season 5 of Tales of Transformation. At a recent conference, I sat down with Neil Batra and David Betts, both principals in Deloitte Consulting LLP, to discuss how interoperability will enable the future of health. Welcome, gentlemen.
It's great to be here.
Yeah, thanks, Heidi.
So this is a very interesting topic. Neil, help paint a picture for our listeners of how and why interoperable data will play a central role in tomorrow's healthcare ecosystem.
Everyone's talking data, but actually not as many folks are talking about the data connecting to other data to actually tell you something. So this is the engine that's going to make the whole thing go. It's one thing to actually have insight in disparate, unique locations. It's quite another when you can connect those data sets and you can actually paint a broad picture about what's actually happening. So interoperability is simply, let me connect these data sets that I'm sort of gathering in the universe. And when I put it together, can it paint a more holistic picture about truth in the universe that allows me, the healthcare system, and also as a healthcare consumer, do something that's precise of the moment, real time.
Yeah, I think that's why, when we talk about it, we talk about radical interoperability, not just interoperability. It's not just about bringing your healthcare data together in a usable format. It's bringing your healthcare data together with your social data, together with your financial data, with data about the environment and the weather, and enabling insight that otherwise we're not going to get unless we're able to really, truly radically interoperate that data in ways that today are probably hard to imagine.
Yeah, I tell a hypothetical story about, let's say a big storm is going to roll through town. If you looked at and you connected these disparate data sets, I bet you see a spike in certain admits in hospitals after storms related directly to folks who are probably not filling their scripts. They end up rationing their pills or not taking their pills. Their disease becomes, when it was previously well managed, unmanaged in the course of this multi-day storm, and they end up presenting into the system, and cost goes up, care goes down, the well go to unwell, and all these bad things happen.
And if I can get a notification today that we're going to have rain starting at 7:18 this evening and it's going to be heavy for a period of 30 minutes, I know that storm is coming. What can I, as a health system leader or a public health agency, do to make sure that those individuals who are most at risk actually have the supplies that they need well ahead of that storm hitting?
Yep. And even more extreme is, let's say a tropical warning is coming through. And me as a health system can say, you know what, everyone? Free drone delivery on your script refills over the next 5 hours. We'll drop it off at your door. And what we know is that's going to actually cut massive costs and massive admin on the back end. And that's interoperable data.
And it also feels radical. The idea that using drones to drop scripts before an emergency, that's pretty radical in my book. We touched on this interoperability that could impact industry players. Can you dive into a little bit more detail about the benefits and why it's such an important shift for the life sciences and healthcare industry?
The fact that you can anticipate who's going to go from well-managed disease to unwell or poorly managed disease because of certain environmental elements or certain lifestyle elements or life dynamics, and you can anticipate that and avoid folks presenting to the system. What's interesting here is, if you get human-centered for a second, what it really is about is having those that have well-controlled disease continue to have well-controlled disease. Or, you want to put that radical hat on, it's those that are approaching disease to actually prevent disease from occurring altogether. That would be really radical.
The benefits from that human-centered perspective are giving me insight and information in real time that's actionable, that allows me to understand what's happening with my disease state and take action that's meaningful and therefore much less costly to me, as both in terms of my out-of-pocket costs, but also in terms of the suffering that I might avoid by understanding better what might be happening to me well ahead of it actually happening and taking action accordingly.
The engaged patient is a healthy patient. I think the bigger question is, how do you get to the majority of patients that implicitly are not compliant?
I think the engaged patient results in better outcomes provided they actually have tools and levers to pull and self-navigate to make better choices. The moment we're in right now is you have a population of agitated consumers who don't have great options to address that agitation. They don't have pricing transparency. They don't have independent third parties offering quality assessments on providers or procedures or the next step in their care. We're at a moment now where you have a real pressure in the system, which is I want better information that lets me make choice. And we're waiting for the businesses to stand up to actually deliver against that.
I think we're seeing a bunch of clunky version 1.0s where early adopters are getting value out of the solutions that are out there. But I think we have to let those either flourish or fail, because that's where we're going to learn how to take it from version 1 to version 2 before the solution was really usable by the masses. So it's okay to fail fast and learn from it. It's okay that it's not perfect. But if we start to push, those organizations that do start to push the boundaries are going to learn faster and get to version 2, version 3, version 4 more quickly, and others are going to fail and fall out.
You know, it's a basic point around disruption theory, which is as you have new entrants that step in and disrupt, they often compete on new bases of competition, which is a new sort of element in the offering. And in many cases, in exchange for giving you a new thing, they're really worse at all the other things. So telephony is a great example. Landlines were super reliable, fairly cost efficient, great quality, and then mobile telephony came along. It was more expensive, much less reliable, sound quality stunk, but you know what? I could talk to you while I was walking on the beach. And there was a swath of consumers who were willing to pay for the mobility and trade off on the performance of the other elements. And this is going to be no different. You're going to have folks say, if you give me those things, I'm okay trading off on some other elements that right now are the sort of the heart of the competition of the marketplace. And that's classic disruption, and we anticipate that playing out.
What do you think life sciences and healthcare companies can learn as an industry from others that are interoperable?
So I'm not sure any industry is truly interoperable. I think what we see are elements of it showing up and enabling some really interesting interactions. So, marketing organizations today are actually blending together data about consumers and learning a lot about how to personalize the interactions that they're having in a retail setting. But even that is pretty clunky and version 1.0 like in many respects. Yes, I'm getting served up content that's relevant to something that I'm interested in the moment, almost presciently at times. But it's still at that stage where it hasn't actually learned when to move on. So I think, yes, there's some interesting things happening with the way that marketing organizations are bringing together data to enable a highly personalized experience, but it's still in version 1.0 in many respects. I purchased a mattress at the end of last summer and I'm still being served mattress ads. So they've picked up on signals in a lot of our digital footprint, but we're still learning how to use it and how to turn it on and turn it off in appropriate moments. For life sciences and healthcare, I think the biggest hurdle today is probably a fear of security and privacy. Everybody talks about security and privacy as being paramount, and I agree that it is, but at times I think we use that as a shield. It's easy to pass off on opportunity that's hard to capture by saying, well, we're not quite ready, the regulations won't allow us. And I would suggest that the regulations probably will allow us. We just need someone to take the risk and think thoughtfully and ethically about how to use the data that's out there to capitalize on what we do know about consumers, their location history, their purchase history, the way they're interacting with devices that can give us clues about health status and allow us opportunities to engage. And I think if we do it right and we do it ethically, we can do it in a secure and private way that creates value for the consumer at the end of the day.
Is the consumer becoming empowered because there are other modalities out there of interoperability? Or is it the healthcare ecosystem that says that the more engaged the patient, the better we all are?
I've actually had this exact debate with a couple execs, and we were disagreeing on the intensity of consumerism. So my view was this is an unleashed power that's going to run and is going to get dialed up as we go. His view was it's of the moment and it's specific to the frustration of the current solutions. And if and when the incumbents address some of the consumerism desires, the intensity and the agitation will come down.
A speaker I heard not too long ago described expectations on the part of consumers when they telephone a shipping company and they get an answer on the first ring, and that shipping company can describe exactly where their package is and when it's going to show up on their doorstep, and they're satisfied and hang up the phone, and then they dial their provider. And they have to work their way through a phone tree to get to an agent who can't really solve their problem. And I think that puts the pressure on the incumbents to satisfy the expectations in the near term, But it won't stop there because they want the same expectation of their health system. And who knows in the next iteration of this, what that consumer will be able to do in another industry that they're going to bring that expectation to bear in the healthcare industry. And so that bar is always going to be rising. I don't think the pressure comes off. I think it's just built up right now because the expectations are high and the delivery is low.
Those expectations aren't always matched with the healthcare ecosystem that we have now. But as the industry continues to progress, earning trust with consumers could be a key barrier to interoperability. Neil, can you expand on that?
Yeah, the trust dynamic is a running concern. It's not just healthcare. Trust matters, and when you betray that trust, there's ramifications around your business, not just your ability to deliver for the consumer, but also your ability to recruit, your ability to grow, your ability to secure investment. I mean, it's a real issue.
It's no longer sufficient to operate from a position of assumed trust. I can't assume that a consumer trusts me. I can't assume that they'll continue to trust me regardless of what I do. I have to operate from a position of earned trust. So what are the signals that I'm sending to the marketplace about how I'm dealing with your data, how I'm exchanging value for the data that you're privileging me to have, so that you continue to grow in the level of trust that you have in me. And the sad part is that it takes one mistake to dispel all of that earned trust and to go back to zero or worse, to go out of business. We have to recognize that consumers are not just going to trust out of the gate. So we've got to send them signals. We've got to do the right things. We have to build the right capabilities. And we have to give them value for the data that we're asking them to share with us. And that's a different dynamic than we've operated from in the past. When that consumer owns that data, we have to earn their trust in allowing them to share it. We have to give them value in exchange for it. The onus is on us to prove it, and prove it not just today, but prove it going forward.
Owning our health data, all of us playing a central role in making these decisions about our health and well-being. David and Neil, thank you so much for joining me today and kicking off this season of Tales of Transformation. Stay tuned for our next episode where we deep dive into research from the Deloitte Center for Health Solutions and explore how life sciences and healthcare companies can go beyond compliance to achieve radically interoperability. Thank you.
Thank you.
Thank you.